Hello, this is Dr. William Morgan with Chambers Medical Group, and I'm an orthopedic surgeon. Many people come quite with some fear about what's going to happen when they come in to see us for examinations. Today we'll show you what the examination is comprised of and go over the reasons why. So once we have looked into the cranial nerves and looked at the face and make sure that neurologically and also from the perspective of the motion of the eyeballs, that there are no fractures of the facial orbit or other structures of the face, we would turn the patient around at this point, and I like to do it in a standing position and come out a little bit more here so we can show what's going on. And that way I can look at the patient's neck, I can look at the alignments of the neck, I can look at the alignments of the shoulders, I can look at the scapula, which are here, and I'll show you how we will look at that, and the back. Many people sustain injuries to the cervical spine, the thoracic spine, or the lumbar spine in this area of the back period. So I would ask the patient, while I palpate the cervical spine musculature, if he has tenderness in those areas. And I could also feel for tightness and see if there is tightness in the paracervical muscles. And then we would look at the trapezius muscles in the back, which are frequently injured in whiplash type of injuries. And also look into the parathoracic muscles, as this is the thoracic spine. And I would check the spinous processes of the cervical spine as well as the thoracic spine down to the lumbar spine. And I would take a little bit more time and be sure that the spinous processes are spaced appropriately so there's no opening or ligamentous instability of the spine as well. At the same time, I can be checking to see if the patient's rhomboid muscles, which control the scapula, are tight or tender, and as well as the quadratus lumborum muscles of the lumbar spine, which are large muscles that are frequently torn and or strained significantly with the motor vehicle accidents. In doing so, I can get an idea if there's any pain that the patient is experiencing from the buttocks down the legs. And what we would be looking at is here in the pelvis are the joints of the pelvis called the sacroiliac joints. And I would press on the right sacroiliac joint and the left sacroiliac joint and ask the patient if there's pain. The other thing that we would look at nearby is the sciatic nerve. Now, the sciatic nerve comes out of the plexus of the lumbar spine. And if somebody has a disc herniation or irritation of the nerve root in any other way, then that would cause some pain of the sciatic nerve, which is located in the buttocks, and I would press on that and ask the patient if they had pain locally and or pain going down the leg. That way I could look and see if we need to get further studies that would include MRIs or CT scan or the appropriate studies. I would also ask the patient to bring both his arms up above his head, like so. Obviously, the patient would not usually have a shirt on, and I could look at the scapula. And the scapula should come out with the shoulders. So part of shoulder motion is the ball and socket joint, but also what's called scapulothoracic motion